Okay, time for breakfast, and this is what I eat for breakfast. I have, this is usually my morning routine, egg whites, or in this case, just a hard-boiled egg, some smoked salmon, which is salty and really good. And I do put salt and pepper on my eggs because I love salt. And then for the sweet part, I have my coffee, of course, and red raspberries or blackberries. Sometimes bananas. I'm gonna eat some of this too. Lots of salt. And then I usually finish the other 2 cups of coffee, which wakes me up. Right now I'm like 70% awake. When I finish this, I'm gonna be like 90 to 100% awake. Then I can come flying through that door at the office and get my day started. Oh, best dad ever. This is for my kids. Great gift. I'm surprised it's not on my plate and all the other objects in the house, but we'll start with a mug and go from there. And I guess if I continue to be the best dad ever, I'll get another one of these. Maybe I need one that says best podiatrist ever. Who knows? I love coffee. W Podiatry, we're walking through the office here. The little office tour. Let's go and hey, it's
Good
Alex.
morning, boys and girls.
It's Alex. Let's see who else is here. Hey guys.
morning.
Everyone's on. This is, look how happy everyone is. Are you guys happy to be at work?
Oh yeah.
Yeah. All right.
We love Dr. Krawetz.
All right. Okay. Well, at least everyone's smiling, right? Right, Alex? Okay. I'm gonna follow my path here, and again, no screams, so that's good. I'm right on top of the entire piece of nail, so you can see this one's a smaller piece than a lot of times than we normally take, but you're gonna see. Let's find out what's in here. So we're gonna turn this, and as we turn, we're gonna pull. I've got a nice good clamp on here, so we're gonna pull that up. There it is, right there. That's the part that's really getting her now. She had a pedicure, and I think the pedicure person tried cutting this out, right? Because I can see how it widens at the bottom. That's the part that was growing in. Take a good look. See how impressed I am? Look at the look on my face. That's an impressed look, see? That means wow. Okay, so it's in there pretty good. So let's clean this out now. And see, there is a little piece of skin here that we're gonna pull out. And people ask why we grab it. The reason we grab it is because the leading edge will actually come right off of there. If I grab it with the hemostat, and you can see, it just follows the line. It's already demarcated for me. See how perfect that is? Comes right out, nice and clean. That looks almost as big as the nail. Again, sensation and sharp and dull, but your proprioceptive sensation sometimes is still there, which is feeling where your toe is in space and actually feeling pressure sensations. And that's what they feel, and they think that they're feeling pain. So I've got a hold of this nail. Kind of did that quick, and we're gonna twist. Ooh, and there it is right there. See the bottom part, how it flares? I'm gonna put this right here. It flares out. So not as impressive as the last one, but it's definitely a big piece of nail. We're gonna see what's left in the side here, because this is a little bit swollen. You're not gonna believe who's here. It's Pink Pedicure Gone Wild, lady. And that Pink Pedicure Gone Wild is now back, but she's cured. It's about a month later, and her toes look awesome, and she even got a pedicure for me after they healed up, and it's not pink anymore. It's like well, you guys will determine it. I think it's like a nude color. So it's nude pedicure, not gone wild. So let's take a look here and see. We're gonna zoom in on this right now. I wanted everyone to see this because everyone wanted follow-up. And this is kind of cool to see because you can see on the sides of the nail where we took it out. I wasn't even sure which sides I took out. And this is her, I think, second. Is this the second 2-week follow-up or third? Probably third. Okay, second. Okay. And you can talk too. It's okay to talk if you want to say anything. But anyway, we did this side of the nail. If you look right here, on the side of the nail. I'm gonna put some alcohol in there. Can you see that? You get up there close, Paulina? Get real close. There you go. And you can see how well that healed. And that's about 5 weeks, I think, since we did it. I was trying to look at the date on the video, on the old video, but it looks super. I mean, this is great. I took my nail nipper and put it in here. And what I'm doing is feeling the sides here to make sure this is like a nice, perfect straight edge to the nail. Her pedicure even looks decent. It's sort of pink, sort of a nude color, not sure. But it looks really good. That's one of the sides that we did. And then we did this side over here. And I'm gonna wipe this too. When I wipe it with alcohol, you can see it really well. Are you able to get real close? Yeah, that's good. And you can see it, it's no longer ingrown. So this is where the deficit is from where we took the ingrown nail out, and it looks awesome. I'm gonna attach the original video to the end of this video so you can see, but this is how it looks about 4 or 5 weeks after. She did good. It's no longer a wild pedicure, it's just a regular pedicure with no ingrown nails on the side anymore. Hopefully she won't have another problem. But she could actually go on with the regular activities. You didn't have any issues with it in the last couple of weeks, correct? Since it's
and it feels awesome.
Okay, so one of the things I had her do, by the way, with this one, she soaked it in white vinegar and water, and she was also using betadine on the sides of the nail the last couple of weeks because she went down to Key West. She was having a lot of fun in Key West, and the nails held up down there, no issues with it, so everything was great. So we have a happy patient here, and she can go on with her regular activities. And this is what it looks like. So now you know what follow-up looks like after it's healed. So not overly excited, but
Very pleased, would recommend anybody here for any feet problems.
and that's great. Okay, well, we'll come back with another great exciting video where there's a little bit more action than this. Thanks.